Thank you. Hello, everyone. As you have seen already, the title of my thesis, uh, it is it is entitled "Addressing Mental Health Problems Among Immigrants." Of course, like I said, my name is Armstrong or Mitabu, and you can see my supervisors at the bottom. That's Dr. Alana and Dr. Karen. Next. So I will, my presentation covers the following section. I'll discuss will be the introduction, the method part, the results, discussion, limitation, conclusion, and I will end with the recommendations. Next. Before I start with the background information, I would like to let you know that this project aim was to find about the strategies for engaging immigrants in health research in Canada, and also about finding the ways of building relationship between the researchers and immigrants. So those were the main aim of this research. So to start with the background information, it was reported that in 2015, over 244 million immigrants or migrants were living outside of their countries of origin. This shows how huge the immigration is nowadays. With regard to Canada, the statistics show that from 2011, the immigrant population in Canada grew from 20.6% to 21.9% in 2017. So the health problems among immigrants is really huge because according to the research done in Sweden, shows that the mental illnesses among the Syrian refugees was 3 times higher that of the native population or the Swedish population. This shows the vulnerability and how the mental health problems among the refugees is so severe as compared to the host country's population. So why is it important to engage immigrants in health research? There are several reasons, but I would like to mention 2 reasons here. The first reason why it's important to engage immigrants in health research is, first of all, engaging immigrants in health research, it leads to high quality research on immigrant health. And second, it is very instrumental. In which way? It is instrumental because whenever the immigrants are engaged in research, they provide information which or evidence which can be based on by decision makers to make policies or take decisions that would positively affect the health of immigrants. Second is that it is instrumental because the evidence or the information that is provided by the immigrants or the research that involves immigrants can be based on by healthcare providers to provide appropriate health to this to immigrant population. Next. So, even though we see that it's very important to engage immigrants in health research, the research shows that there are a lot of challenges of engaging immigrants into health research, mostly because of the cultural differences or the trust issues between the immigrant population and the health researchers. And due to that reason, we came up with 2 research questions which could help us to go much deep and try to find out about the strategies and the ways in which the researchers and immigrants can build a relationship to enhance patient-oriented research. So the first research question was, what are successful strategies applied to engage immigrants in health research in Canada? And our second research question was, how can interior health in those relationships between vulnerable immigrant patients and the researchers in building capacity in patient-oriented research. Next. So for us to conduct this research, we used a research method, whereby this research was a qualitative research, and we conducted a systematic literature review, whereby we focused on 4 different countries, namely Canada, the Netherlands, US, and the UK. And to analyze our data, we used meta-analysis methods. Next. Next. So, for our findings, first of all, with regard to engaging the immigrants, about the strategies used to engage the immigrants in Canada, we found out 2 main approaches. The first approach of engaging immigrants into health research was gatekeeper approach. In this approach, we found different components of this approach. One of the methods in this approach was recruiting or engaging immigrants through medical staffs or through clinics. And the other component was engaging immigrants through community health centers that serves different immigrant groups like refugees. And we also found the third component under the gatekeeper approach, which was recruiting or engaging immigrants via organizations that work with immigrant settlements. Next. So the second approach of engaging immigrants in 12th research in Canada was the prolonged engagement approach. So this approach used the insiders, some members of the immigrant community, to facilitate the engagement, so to connect the researchers and the community. Another component under prolonged engagement was prior engagement of external researchers. This where the researchers are involved in the immigrants community prior to the actual research. And lastly, under prolonged engagement approach was engaging immigrants by use of people who more often interact with or who have a positive relationship with the immigrant community. Next. So, as you say, there are challenges, there are barriers with regard to engaging the immigrant in health research. So, the first category of barriers was immigrant-related barriers. So, among the immigrant-related barriers, we found out that one of them is language proficiency, where the researcher is not able to speak the language of the target population, who are the immigrant population, or vice versa, where the immigrants are not able to communicate efficiently in the language in their host countries, which the researcher speaks. And of course, we also found that under the language, that there is a subtle language problem. Some immigrants may be able to speak the language of the host countries, but may not be able to use the light expression. And this can be a problem in the communication between the researchers and the immigrants. And the second barrier, and the immigrant-related barriers, was fear, because many of the immigrants they fear to provide information because they are not sure in which way the information is going to be used. And other immigrant-related barrier was lack of incentives. Immigrants are not willing to participate or to engage if there is no incentives involved. Next. So, even though we see that there are immigrant-related barriers, there are also research-related barriers or research-related barriers. So among the research-related barriers is lack of cultural competency. This when the researchers are not competent about the culture of the immigrants. So this as well a barrier. Language is another barrier also on the side of the researchers, especially if they are not able to speak the language of the immigrants or the language which the immigrants could easily understand at all. This is also a barrier on the research side. Next. And of course, under the language barrier, there is subtle language problem where the researcher are not able to use the right expression, even though they may speak the language of the immigrants, but they have difficulties of using the right expression to communicate with the immigrants. There is as well another barrier, which is poor planning, mostly if the researchers are not aware of the target population, ethnic or cultural holidays and so on, if they don't know the convenience of the immigrant population. So planning can also be a barrier if it's not well done. And lastly, under the research-related barriers, we have hesitation of some researchers to help in recruitment process. We found out that some facilitating organization, the researchers in some facilitating organization, they are reluctant to facilitate the research process in case a researcher from outside wants the help of this organization. Because this organization, they don't want to be responsible in case something goes wrong in the research process. Next. Could you go? Yes. Yes. There are also facilitators for engagement, and among the facilitators for engagement, there is cultural congruence, there is use of insider throughout the process, not only using insider, for instance, for recruitment, but when the insiders are used throughout the research process. Also, it was found that among the facilitators is when the researchers are able to use the right terms, when they avoid the terms that have acquired stigma, for instance, like using terms as refugees or asylum seekers. And of course, the last facilitator is training the researchers about the training about the research techniques and about the cultural issues that relate to the immigrants, to the immigrant community. Next. So to go deeper into discussion, we're going to see about the implication of recruitment or engagement strategies. We saw that among the engagement strategies used to engage immigrants in health research in Canada, one of them was engaging them or recruiting them through clinics. This is one of the main methods or strategies used because the researchers assume that health clinics where the immigrants go to seek medical care, they have more access to immigrants, and through this channel, then the researchers are able to recruit the participants or to engage the immigrants. The second method was the contacting the immigrants via organizations. This has been found to be the most common method used by researchers to engage immigrants in health research in Canada. This mostly through the organizations that work with the immigrants. But it has been found that using or engaging immigrants through clinics and engaging immigrants through organizations that work with immigrants is not enough. And is not enough. So, in order to achieve a successful engagement research or strategy, the, on top of engaging the immigrants through organizations and clinics, the researchers have to use incentives to motivate the immigrants to participate in research, because sometimes immigrants cannot see the benefits of participating in research. So after contacting immigrants through the organization and clinics, it is very important to use also the financial incentives or other different incentives in order to motivate the immigrants for these strategies to be successful. We also found that another strategy used to engage immigrants into health research was to contact them via insiders or cultural brokers. This is where the religious leaders from the immigrant community or the cultural leaders are used as mediators to bring in touch the researchers and the immigrant community. And this is very important because the immigrant community have trust in their cultural leaders and the religious leaders. So by using this strategy, you have the trust of the immigrant community. This is a strategy that is not more often used, but which is really one of the more successful or effective strategy. And the last strategy of engaging immigrants in research found was prior engagement of researchers. This is where an external researcher gets involved in the immigrant community prior to the start of the actual research. So this is very important because by getting engaged in the immigrant community prior to the actual research, it gives a researcher an opportunity to know more about the concerns, the needs, about the cultural issues of the immigrant community, and it as well facilitates building a relationship between the immigrants and the researcher. So by the time a researcher starts the actual research, he had already built a relationship. So this is also a very important strategy also used in Canada to engage the immigrant in health research. Next. So what are the implications of barriers and the facilitators? It is also very important if the researchers are to build the relationship with the immigrants or the target population, who happen to be the immigrants in this case. They have to be aware of the barriers that could make that relationship or that contact go wrong, and they also have to be aware of the facilitators. Starting with the barriers, language proficiency is very important, especially when this is very important because the researchers can only build the relationship with the immigrant community if they are able to effectively communicate with them. So language is very important. If the language, if the researchers are not able to speak the language of the immigrants, or the immigrants are not able to speak the language of the host countries, this becomes a barrier to build the relationship between the two parties. The second barrier was fear. The research shows that many immigrants are scared of engaging or are afraid of engaging, of coming into contact or participating in research because they are afraid that the information that they share could be used to prosecute them or could affect their, for instance, their application procedures. So fear is one also of the barriers that which keeps the distance between the immigrants and the researchers. And still talking on fear, the research also found that fear has another negative impact because especially when it comes to the comers immigrants, most of the newcomers immigrants, they participate in research because of fear and perceived sense of obligation. Sometimes they think that if they don't participate in research, there could be some consequences. So this could have also unintended uh, impact. So fear is one of also of the major barriers. Of course, like we discussed before in the results section, lack of incentives is also another barrier. In most cases, when the immigrants don't see how the research will benefit them, they're not willing to participate. They're not willing to come into contact. So when there's no incentives, so this can be a barrier to bring the researchers and the immigrants into contact. Of course, also lack of cultural competency. This is very one of the major barriers because when the researchers are not aware of the cultural the cultural beliefs of the immigrant population, if they're not aware of their values, their norms, and so on, the immigrant population feel their culture violated, and in that case, or they feel their culture disrespected, and in that case, they're not willing to participate. The lack of cultural competence is also one of the major barriers, and of course, language barriers, like if they're not able to communicate, if they're not knowledgeable about the language of the immigrants, that's also a barrier. And like I said, if the researchers are not aware of the immigrants' cultural holidays, religious holidays, family and relatives visits, and so on, this can also be a barrier if they don't plan this wisely. So even though there are barriers, there are as well facilitators which can help to enhance the relationship between immigrants population and the researchers. The first one found was cultural congruence. This is very important from the immigrant side because they are willing to get in touch and come closer to with the researchers if they feel that their beliefs, their culture, and their values are respected by the researchers. So when the researchers are aware of this, this can help build the relationship with the immigrant population. Also, using the insiders for the process, this is also a facilitator to build the relationship between the two parties, because the research shows that it's very important to involve the cultural leaders and ethnic leaders and these influential people from the immigrants in the research, because these people have the trust of their community, and by involving them throughout the research process, this facilitates building relationship with the immigrant community. So avoiding the terms that have acquired stigma is another important facilitator. Because according to the research that was done in the UK, it shows that some immigrants are not willing to interact with the researchers if the researchers use some terms which have acquired stigma. For instance, like identifying the immigrants by terms like refugees and asylum seekers. These are not the terms that the immigrants would like to be identified with. According to the research, some immigrants would like to be identified with terms like forced immigrants instead of identifying them with terms like asylum seekers and refugees. So knowing the right terms to identify them is very key in order to build the relationship with them. And of course, training the researchers about the cultural issues and research techniques, this is very key as well to establish a relationship between the researchers and immigrant population. Next. So even though we were able to come to those findings, there were some challenges in this project because the first intent of this project was to focus on about how to engage the immigrants in mental health research. But because we couldn't find sufficient articles, we decided to broaden the research from mental health to health in general. So that was one of the challenges we faced. And the second challenge was that we couldn't find enough publication on some of the countries we involved in this research. For instance, one of the countries on which we focused on was about the publication or about the publication in France, but we couldn't find enough literature. So instead of reviewing publication or studies in France, we decided to replace France with US. So we also viewed publication about this topic in the US. Next. Next. So to conclude, we found out that with regard to engagement strategies of immigrants in health research in Canada, we found that the widely used the well-used method was engaging immigrants through organization that works with immigrants. But we found that engaging immigrants via organization on its own is not enough, cannot be successful. It can be successful only if on top of that, the incentives are provided to the targeted population or to the immigrant population, and then this can increase their motivation to get engaged in the research. We also found that it is very important to know that for newcomers, in most cases, they participate in research not because they want to, but because of fear and sense of perceived obligation. Because in many cases, they don't have information about participation, and in that case, they perceive that in case they don't participate, there can be some negative consequences. So some of the newcomer immigrants, they participate due to fear and sense of obligation. Next. Like I've seen with the main barriers to research, we'll find out that the research-related barriers are mainly the language, cultural competence, and poor planning. And with regard to barriers that are immigrant-related, language was as well an issue, fear, and lack of incentives. So, in order to enhance the bonding or the relationship between the researchers and the immigrants, we found that it is very important for cultural competency training for the researchers, and as well training the researchers about the research techniques is very key as well. And we'll find out that even though the cultural brokers are not used in many cases, but that's very also key, very important to use cultural brokers like religious leaders or cultural leaders from the immigrant community if you are to build the relationship between the two parties. And incentives has as well been very important to bring the immigrant and the researchers together. Next. So after conducting the research, we also came with some few recommendations. It is very important that more studies need to be done to determine the level of disparity in participating in health research that can be attributed to the challenges faced by immigrants as compared to the general population. The recommendation is that more research needs to be done to determine whether engaging other population groups need to follow the same practice. And lastly, institutions and the researchers working with the immigrants, they should be aware that, or do recommend them that to consider both the majority and minority perspective while dealing with immigrants, immigrant population. Next. So this was my presentation. I thank you all for your attention. You're welcome to ask, if you have any question, you're free to ask, or if you have comments or any remarks, so you are free to do so. Thank you so much for your attention.
All right, thank you for that, Armstrong. So now that he has finished with his presentation, I'm going to just start unmuting people, and feel free to unmute yourself, and also if you want to use the chat box to share any questions that you may have for Armstrong, you're also welcome to do so. So have anybody with any questions for Armstrong right now?
There are no questions in the chat box.
Anybody with any questions that? Yeah.
I thought it was well done.
Oh, sorry, Paul. Okay, there we go. Okay, let's try that again to see if maybe that works.
Thank you very much, Armstrong. It was well done.
Thank you.
Thank you.
Welcome.
Any questions for Armstrong? Anybody want to put him in the hot seat for his presentation at all, or are we okay? Oh, we have a comment, actually. Colleen, did you want to share your, have any questions or share your comment with the group, or?
Hi there. Can you hear me?
Yes, we can. Perfect.
Okay, thanks. Sure, I'll read out what my question was. The term participant is used throughout the presentation, and I often find that term can be confusing because it can get confused with a study participant. Patients participating in research is often like, you think a study subject. Are you all, a question to Armstrong, are you always referring to immigrants as research partners and members of the research team, or how do you define participate and participant? Thank you.
Sorry, there was a little bit cutting from my side. Can you repeat your question?
Oh, sure. And it's also in the chat box, but I think the term participant can sometimes be confusing because, at least here in Canada, when we talk about study participants, we're usually talking about study subjects. And I'm wondering if, when you use it in your presentation, you're always referring to immigrants as research partners, like helping to determine research priorities, design research projects, interpret research results, and so on? Or are you also referring to immigrants as study participants?
Thank you for that question. I think it's a good question. When I'm talking about participants, it's hugely participants in terms of in terms of partners, because other than expressing their views about other than expressing what they think, their concerns and so on, they can as well be involved in the research process. So by coming in contact with them or by working with them, they can as well be part of defining the research, being part of every research process, other than just coming in the research, being asked questions and ask the questions, but as well have a say in what they think is priority and on what they think that could be focused on what they think that matters most. So I think it takes both sides. They can participate, they can be participants in terms of answering what we need from them, but as well in having their say of what they think about in which way the research should be conducted and what should be the priority in the research.
Okay, thank you very much. I appreciate that clarification. Wonderful presentation. Thank you, Armstrong.
Yeah, well.
Thank you for your question as well, Colleen. Do we have any questions? If you do, you can share via the chat box or unmute yourself if you're muted to share your questions and any comments that you might have for Armstrong.
Hi, this is Kelly
Hi.
calling. Hi. This might have been covered in the first few minutes of the presentation. I only joined about 8 minutes into it, but I'm wondering, did you do research on any countries or specific areas in particular, or I'm just wondering where, what areas did you get your research from? Like what countries specifically?
Yeah. Okay, thank you, Kelly. That's a good question. Actually, with regard to because this research had two main research questions. So to answer the first research question, our focus was about Canada, about the strategies used to engage the migrants in Canada. So the main focus was in Canada. But with regard to finding out the way of building a relationship between the immigrants community and the researchers, we look for literature from the case study countries involved, which were mainly UK, the Netherlands, Canada, and the US, mainly because these countries have long history of hosting immigrants population, and we really want to see what are the ways used to build relationship with between the immigrants and the researchers. So with regard to the second research question, we focused on the 4 countries, but the first research question was mainly about was focusing on Canada.
Great, very interesting. Thank you.
You're welcome.
Are there any more questions for Armstrong? Feel free to chime in at any time. Looks like that could be it for, maybe that could be, we have one from Bill. If you open your chat, that says, thank you for your presentation. If you could do the study again, what would you do differently or change? So that's a question for you, Armstrong.
Actually, if I would do the study again, like I told you, I would like, I would mostly focus about to go deeper, see the differences between these countries about the approaches. So I didn't really go much about the countries there involved. I didn't go that much deeper. So this is something that I would do different. And of course, like I said in the recommendation part, there are some areas or some specific issues that I highlighted that needs more attention that I would like to focus more on if I had enough time. I don't know if I answered the question.
We have a comment from Karen. Karen is asking if people can contact Armstrong after the presentation. Yes, as we stated, we will have this presentation on our website, so you guys can view it after this, and it should be up there in the coming weeks. And if possible, and if Armstrong is okay with this, we could have his contact information too, located at the bottom of the presentation. So if anybody has any comments or anything, feedback for Armstrong later on, after they let this simmer as well, they can use that to contact him. So I'll talk to Armstrong about getting whatever contact information he prefers, and we'll have that at the bottom of the presentation that goes on our website as well. Yes.
Thank you.
I've got a question for Armstrong. Do you think that this research could help inform health authorities' future plans for cultural competency training?
I think, thank you for the question, first of all. I think it can be informative. In a way, it's not that deep about informing about which really strategies or which main issues, cultural issues to focus on, but I think it's informative in a way that it highlights about what issues matters from the immigrant's perspective. For instance, if it's about cultural competence, about knowing their, respecting their, being aware of their beliefs, being aware of their values, and so on, what is acceptable from their side, I think it highlights a little bit about the importance of cultural competency. But it's not that much deep into that specific issue. But of course, cultural competency is one of the issues that has been lighted to be very important, that the researchers or the health providers or researchers should focus on. I don't know if I answered it correctly, if I understood your question.
Thank you for that, Armstrong.
If you're not satisfied with the answer I provide, maybe you can ask it again, and I can try to explain or if I understand it much better.
No, I think that makes sense. Thank you.
Okay.
Do we have any more questions or comments for Armstrong? We'll give it maybe a minute or a few seconds to see if anybody's simmering with a question before we end. Hearing none then, I would like to thank you for the presentation, Armstrong. That was actually quite informative. From my personal opinion, I'm sure many people on this chat would agree. So once again, as I stated before, please keep an eye out for this presentation on our website. Once again, that's the BC Support Unit. .ca, and we'll have it there, and we'll have his contact information as well at the bottom of that in case anybody might have any questions or issues. So thank you again, Armstrong. Thank you, everybody, for participating. Bye.
Thank you. I thank everyone for participating.
Bye-bye.
Bye.
Bye.
Bye. Bye. Thank you.
Bye.